In this video, here's what we'll cover: what health anxiety really is, the worry, checking and reassurance cycle, how Dr. Google feeds the fear, why reassurance backfires, what evidence-based treatment can do. It often starts with something small: an ordinary headache after a long week, a flutter in your chest, a new ache that wasn't there yesterday. For most of us, that twinge comes and goes, and we barely think about it again. But for some people, a small sensation does not stay small. By lunchtime you have searched your symptom 3 times. By dinner you have read about the worst possible cause, pressed on the sore spot again and again, and asked someone you love, "Does this sound dangerous?" The relief lasts about 10 minutes. Then the worry creeps back, louder. If that feels familiar, I want you to hear one thing clearly. You are not being silly, and you are not seeking attention. This pattern has a name. It is called health anxiety, and it is one of the most treatable problems I see in my practice. Let me walk you through what it is, why it takes hold, and how the right help can give your days back. So let me start with what health anxiety actually is. It is a persistent, distressing preoccupation with the idea that you have, or are about to get, a serious illness. It is the fear itself that takes over. Not just an occasional worry, but a pattern that drains your time, energy, and peace of mind. Most people worry about their health sometimes, and that is normal and useful. Health anxiety is different in 3 ways. The worry is intense and out of proportion to any real medical risk. It is persistent, often lasting months and jumping from one feared illness to the next. And it causes real disruption to sleep, relationships, and work. Importantly, the sensations are genuine. A headache, a racing heart, a skin blemish. These are real. Health anxiety is about how the mind interprets ordinary signals, reading them as proof of something terrible. Now, why does it keep going? This is the second thing I want to show you. The worry, checking, and reassurance cycle. It runs like this. First comes a trigger, a bodily sensation or a piece of health news. Then a catastrophic interpretation, where the mind jumps to the worst. This headache is a tumor. Anxiety rises, and stress itself creates more sensations: a thumping heart, tense muscles, a churning stomach, which feel like more evidence. To ease the dread, you reach for safety behaviors. You check your body, search online, or ask a loved one, "Do you think it's serious?" The reassurance soothes for a short while, but because the underlying fear was never truly tested, the worry comes back, often stronger, and so the loop spins again. Each lap makes the brain more sensitive to the next small sensation. The problem is not a lack of willpower, it is a self-reinforcing pattern. The third piece is one many of us know too well: how Dr. Google feeds the fear. Searching your symptoms online feels like taking control, but for an anxious mind it usually pours fuel on the fire. Researchers even have a word for it: cyberchondria. Repeated online searches that raise anxiety rather than calm it. Studies suggest the relationship runs both ways. People who are more anxious search more, and more searching makes them more anxious. The trap is built into how search engines work. Type in a common symptom, and the rare, frightening explanations sit right beside the harmless ones. An anxious brain zooms straight to the scary result and treats it as the most likely answer. One search rarely ends it. It leads to another, late into the night. That brings me to the fourth thing, and it is the hardest to accept, because reassurance feels so helpful. Why does reassurance backfire? When you ask your partner, your doctor, or the internet, "Am I okay?" and you hear yes, you feel better for a moment. But the relief is the problem. The brain learns that the only way it felt safe was by checking. So the next time anxiety rises, the urge to check returns, sooner and stronger. The fear is never given the chance to fade on its own, because you keep rescuing yourself before it can. This is why, in treatment, the goal is not the perfect reassurance. It is to gradually let go of reassurance seeking, so your nervous system can learn that the feared catastrophe does not come, and that uncertainty, while uncomfortable, is survivable. Which brings me to the good news. The fifth thing: what evidence-based treatment can do. The most strongly supported approach for health anxiety is cognitive behavioral therapy, or CBT. A large trial published in a leading medical journal found people who received CBT adapted for health anxiety improved significantly more than those on standard care. and held those gains over time. In my practice, CBT usually means mapping your own cycle together, gently retraining attention away from constant body scanning, and running small experiments to test what happens to anxiety when you don't check. Step by step, we reduce checking and reassurance so anxiety can rise and then settle naturally. A second evidence-based path is acceptance and commitment therapy, or ACT, which helps you make room for uncertainty while you invest your energy in what matters. I often draw on both, tailoring the mix to each person. Health anxiety is common, understandable, and very treatable. With the right support, you can quiet the cycle, trust your body again, and get back to a life bigger than your worries. If this has been running your week, warm, practical help is close to home at Potentialz Unlimited in Bella Vista. You can read the full guide, or book an appointment, using the links below. Before you go, here's a quick recap of what we covered. What health anxiety really is. The worry, checking and reassurance cycle. How Dr. Google feeds the fear. Why reassurance backfires. What evidence-based treatment can do.